share with you. So thanks very much for having me this morning. A great mentor of mine told me that the secret to success was to show up. So thank you very much for showing up today, and hopefully we'll give you some value and some good tips you can take away and start to make some changes and help yourselves immediately. So we're going to get into the subject shortly, and before we get started, is it alright if I tell you a bit more about myself? Yeah. As I said, I'm Dr. 𝗲𝗵𝗄𝗹. As chiropractors, we train for 5 years, so that's why we get to call ourselves doctors. I've been in practice for 13 years. I've helped thousands of people in that time, suffered with all sorts of different complaints. The majority, which if you know chiropractic, you may think about, is neck pain, back pain, headaches. We see people with all kinds of ill health and problems, especially nowadays, postural stresses, responding really well to chiropractic. So I've practiced, I'm originally from Bristol. I practiced for a few years. I practiced down in Bournemouth. I spent a year practicing in Singapore, which was a fantastic experience. For the last 5 years, I've worked in the 𝗃𝗶𝗱𝗲, Crawley and 𝗃𝗏𝗋𝗃 areas. And I've owned 2 practices in these areas, and that's what brings me here to you this morning. So I've spoken to different organisations around the world, different companies and schools, including government organisations in Singapore, and just talking about the importance of health, good posture and spinal health. So today we're going to talk to you about posture. We're going to show you how you can assess yourselves and look at your own posture. And one of the most important research studies I read was that you learn more when you're awake than when you're asleep. I will be asking for a bit of involvement this morning, with some show of hands and some volunteers at some point as well. So bear with me in that sense. If I do go a bit fast, we are trying to fit quite a lot in, so do give me a shout out to slow down or repeat anything. We're very passionate about what we're going to talk about. What I'd like to talk about to start with, and also I know you guys are heavily involved in diabetes research, you're aware of health and health challenges. So I just want to talk about a few stats. I'm not the greatest at remembering stats, I've got some written down here. Do we think in the UK the stats for neck pain, back pain and headaches and musculoskeletal disorders are going up or going down? And general health stats, is our health improving or decreasing? And stress and anxiety levels? You might see I've got some anxiety levels at the moment. It's natural when giving talks. So they're rising generally. I think we'd all agree that we're facing some heavy health challenges in this country. So you may have heard the phrase sitting is the new smoking. Sitting is to our health as coke is to our teeth, these kind of things. So we sit for a long period and it is having an effect on our health. So we just ran through some stats, just most up-to-date stats. So sedentary lifestyles and poor postures